Welcome to another edition of the Brain Injury Radio Network.
Brain Injury Radio and Radio Ability are sponsored by the TBI Network.
Find them on facebook.com/TBI Network or at tbisn.org.
Brain Injury Radio is on 7 nights a week. And now, for tonight's episode of Brain Injury Radio.
Hello there, listeners. This is Brain Injury Radio, and the show tonight, We Deserve Better, with me, Doran Rosenfeld, or Dr. D. I have a special guest with me tonight. This man is Joseph Jacobs, and he developed a new technique for helping people to deal with chronic pain. And most of us have experienced some sort of pain we can't seem to get rid of, or something that keeps coming back to haunt us. Hopefully, Joseph will tell us some hints tonight about what are some ways that he can treat that, because he treats basically everything involved with scar tissue, the bones, the muscles, the joints, the skin, the fascia. He does advanced soft tissue release, and that technique is a state-of-the-art, specially patented technique created by Dr. Joseph Jacobs. He's a doctor of physical therapy. This technique specializes in the evaluation and treatment of soft tissue pain and impairment associated with TMJ disorder, jaw pain, headaches, muscle pain, joint pain, trigger points, scar tissue, myofascial restrictions, and soft tissue adhesions. Now, who hasn't had one of those or more of them at one time going on with your system? Dr. Jacobs invented some special techniques and some special instruments to help deal with those techniques, and we're going to talk about them tonight. So I'd like to introduce my guest, Dr. Joseph Jacobs. Hello there, Joseph.
Hello, thank you so much for the great introduction. It's an honor to be on your show.
Okay, so most of us want to know how we can deal with these aches and pains we have all the time. So why don't you give us a quick introduction about how to deal with them, or how you deal with them?
So dealing with chronic pain, it's a complex condition, and the treatment has to be very comprehensive. So what I use with ASTR is it's a biopsychosocial treatment model. That model been developed in 1977 by Dr. Angel, and it's basically treating the body as a whole instead of focusing on one element of the problem. So the model advocate for treating the physical part, the physical pain, the emotional pain, and the psychological and the social part that involve in chronic condition. So, and that's one of the things that I use with my patient. And for soft tissue specifically, what I have found that a lot of the modality and technique we currently use just focus on the symptoms instead of treating the source of the problem. And in order for us to get relief, actually, we need to investigate and try to figure out why patient experience pain. For example, so what I learned in school, if someone has a restricted range of motion or tightness, we'll do stretching and strengthen the muscle that's weak. But what we do for pain is Currently we use like a stem or ultrasound or heat or cold, and those modalities showed in studies that it provides temporary pain relief. What we need to start to, as a practitioner or as a patient, to ask why I'm experiencing pain. And when I start to ask that question, that's when I realize it's not the muscle tightness. There's something deep that's going on. One of them is a scar tissue. The other thing is fascia restriction, trigger point, and muscle spasm. And that's when I start to, I can briefly, how this started is my wife used to suffer from chronic TMJ, jaw pain, for over 3 years. And during that time, I tried with her the techniques I learned. I took even continuing education classes that specialize in TMJ. But she experienced relief, but the relief was like for 1 to 2 days, did not last. One day she woke up with a lockjaw. She was not able to talk or to eat. So, but she asked me to try anything, and I told her I tried everything I can try with you. And then I reached it inside her mouth and start to release the tightness inside her mouth. And after a few minutes, I just experiment like random stuff on her because I don't know what to do with her. Hopefully that will work. And after a few minutes, she was able to open her jaw and she was pain-free. And that's when I started to think there's something else that going on here that could be helping patient. So it took me several weeks after that to understand the concept that I used on her. And after that, I developed over 125 maneuvers. And a few months later, my hand was killing me because I was using my hand a lot. And I started to, I went actually to a hardware store, get a PVC pipes and rubbers, and start to make tools. And that's when ASTR started with the tools to break scar tissue, release fascia, trigger point, and muscle spasm.
So we can thank your wife for some of this.
Yeah, she's actually she was my guinea pig, and she was the best guinea pig. She inspired me to start to think out of the box of treating chronic condition. On the other side, I'm a cancer survivor twice. And during that time, I was actually, the second time was like cancer from the first treatment. It's a side effect. So, and during the time, I had chronic fatigue, migraines, pain, and I was really frustrated of the outcome of the stuff I learned, and I tried to apply it myself. And I did not feel relief, and that was another factor that was motivating me to actually investigate and try to get to the root of the problem. So ASTR started with technique like using instrument to release fascia and scar tissue, muscle spasm. But when I start to work on my condition and I realized with my patient the same thing, the treatment has to be more comprehensive than this. Scar tissue, fascia restriction, muscle spasm, that's a great result with the musculoskeletal, but when we're dealing with chronic condition, we have to work on nutrition, inflammation, ergonomics, posture. It has to be holistic, working, doing some meditation, stress management. And what I found is that model, the biopsychosocial model, that's the model that's very effective to address all of that. So I encompass all these elements in ASTR treatment. It's similar to, when you go like have a car tune-up, you want to go to a mechanic that actually change the air filter only and tell you that you need to go to another mechanic because, I can only change the air filter. You need to go to someone else to do sparks plugs. So that's actually what Dr. Angel was advocate, that we cannot treat patients just for body parts or just pain only. We have to treat the entire system. And that's what I use with ASTR treatment. So I try to find the most effective meditation exercise, most effective ergonomic approach, most effective nutrition approach. And I can encompass all of that in holistic approach with its ASTR treatment. So instead of its technique, it's a specialty. So it's training I provide that training for doctors, so they will be able to implement the entire program instead of just releasing the scar tissue and, not addressing the other part of the problem.
That's true, because most people find themselves focusing on one or two specialties.
And actually, there's a lot of there's a lot of study, a lot of systematic reviews that showed the biopsychosocial model is provide a long-term result compared to the medical model or single discipline. The problem with that, and that's what I found as a patient and my patient too, is to implement the biopsychosocial model, you have to go to 4 or 5 disciplines. So it requires 4 or 5 hours a week and require 4 or 5 co-payment. So it's basically you would be like full-time just going to healthcare provider. And how to solve this is to train the healthcare provider to be able to manage majority of this condition with the training that they received. If someone needs something really beyond the scope of the practitioner practice, we need to refer it out. But a lot of stuff you can, like chiropractor, physical therapist, or occupational therapist, they can give the patient meditation exercise. They can give them instruction about behavior modification. They can do the soft tissue with the instrument. They can do nutrition. So it's about having the healthcare provider is more efficient to get to the root of the problem to help the patient better in a short period of time instead of going to 5, 6 healthcare providers to get the biopsychosocial model treatment.
That sounds very reasonable.
Yeah.
I mean, are people accepting your treatment? Because I frankly hadn't really heard of it until I met you and read it about on your website. So how do you get the word out?
Well, I had a TEDx talk, I think a year ago, and I have a lot of videos for ASTR treatments, and I have a lot of followers on LinkedIn and YouTube, and that's how people get the word out. Yeah.
Okay.
And we get a great result with that.
Okay, very good. Because everyone, or most medical practitioners, can find a place in your system.
That's correct. So I currently I train the classes that I teach. I have chiropractors come, PT, physical therapist, occupation therapist assistant, even athletic trainer, because all can benefit from learning how to implement that on patient. I think it's the future of our healthcare. It's not about specialty that really micro-focus on one element of the problem. That's great if you're going to go to the surgeon. You want to go to someone really specialized in shoulder or knee because they're going to be very good at it, and you want that. But to treat chronic condition, you have to think about the entire body. We cannot really separate the emotional part or the psychological part from the physical part, from the ergonomics or from nutrition. Very good example of that is just think about someone has a traumatic brain injury from motor vehicle accident. So as soon as they had that accident, they start to have, for example, tightness in the neck and inflammation. So they start to adapt bad posture and bad ergonomics. So now you need to work on ergonomics and posture. And they stress out because they're scared to drive again because they think they're going to get into another accident. So you need to do meditation with them and some psychological treatment. While this happening, they're not paying attention to their diet, and they eat diet that cause more inflammation. So now the practitioner needs to work on nutrition. And during this time, like the inflammation start, and you start to have from the accident, micro tear in the muscle, and that micro tear has to build the scar tissue to heal. And when they have a lot of scar tissue, that decreases the range of motion and could cause pain or compress on nerve and artery, cause a lot of make the symptoms more severe. During that time, the fascia start to restrict because a lot of scar tissue on the fascia system, and then the patient will experience muscle spasm. So you see, with all this scenario, it's not one element. We need to address the scar tissue. We need to address the trigger points. We need to address the muscle spasm. We need to address the nutrition, the inflammation, the stress, the behavior modification. And this way you actually can get a better outcome than just going to have, massage or soft tissue treatment and that's it.
Right. We recently had a patient in our chiropractic office who left because he only had a limited amount of money to deal with his accident, and he felt a massage would feel better. So he stopped the chiropractic treatment to get a massage. Mm-hmm. Well, like you said, you have to work on everything at once.
That's correct. And actually, studies showed is massage provides temporary pain relief. We need to start to think about why the patients start to have tightness. And I have massage therapists taking the class because the healthcare practitioners need to learn how to evaluate scar tissue because it's extremely common. When we look at the healing cycle, there's 3 stages for healing in order for the body to heal. So just visualize it with me. For example, external paper cut. The first stage is inflammation. There will be swelling in that area, redness, the blood start to rush to that area. That's the inflammation stage. The second stage is called the proliferation stage. That's when the body starts to build the scar tissue. So if our body does not build the scar tissue, that paper cut will be open wound susceptible for infection. So actually scar tissue is very essential for our survival. That's the second stage of healing. And during that stage, the proliferation stage, there's always a scar tissue that get on the fascia layer and that cause fascia restrictions. And it's very common that you start to have muscle spasm and trigger point during that stage, the proliferation stage. The last stage, that's in the perfect scenario, it's called the maturation stage, and that's when the body actually dissolves the scar tissue and clear it up by itself. That could take days, weeks, months, or years. And with chronic condition, actually patients do not get to the maturation stage because they are in chronic condition. They either are stuck in the inflammation or the proliferation stage, or they actually going back and forth between inflammation and proliferation stage. So when you look at the cycle, there is at least 5 elements here that need to be addressed for this patient. 1 is inflammation, 2 scar tissue, 3 fascia restrictions, 4 muscle spasm, 5 trigger point. That's without even looking at the ergonomics or nutrition and the rest of the list. So it makes a lot of sense when patient has an injury, because the example I give is just for external paper cut, but the same process happens internally from any accidents, trauma, poor posture, poor body mechanic. Patient will start to have micro tear in the tissue, and that micro tear start to It's the healing cycle starts again with inflammation and the scar tissue, the proliferation stage, and the maturation if it's healed. But because practitioner and patient do not see the internal damage, there is like lack of understanding or lack of like believing it exists. But the same process happens internally. So as a healthcare providers, we need to know how to evaluate patient based on the healing cycle, so the treatment will be more accurate. Instead of saying you have pain, so let's give you ice and heat to relieve the symptoms. But why you have pain? That's when we should start to investigate the healing cycle.
Mhm. Correct. Yeah. Yeah, it's very nice. So, how soon after an injury do you recommend people see you?
So I see a patient the next day or after the injury. It's better to address injuries in early stages than in the late stages because they usually less damage happen to the tissue. In the early stages, during the evaluation, it's probably re-inflammation, so I will work on inflammation to speed. It's actually to promote the body normal healing cycle and to do whatever we can do to speed up this process. So if we can see the patient on early stages, we can help them to actually transition from one stage to another quicker.
I see.
For chronic condition, you're working on a lot of past damages that, especially if someone like stuck in inflammation stage, the body usually go from inflammation to proliferation. It's a kind of like going back and forth vicious cycle. And when we really actually look at the normal healing cycle, I'm simplifying by those three stages. And in a lot of books they simplify it in those three stages, but in reality, it's overlapping. Like there's part of proliferation and the inflammation, but that part is lower than the inflammation part. And there's part of the inflammation in the proliferation stage. And that's what, when the healthcare provider needs to be really competent of knowing where the patient is stuck or where the patient located from the healing cycle in order to help them to transition quickly to the maturation stage.
I see. Yeah, because, for example, when I had my head injury 35 years ago, my brain swelled up, and it took a while for the swelling to happen. And I developed epileptic seizures 5 years later, after my brain had gone through the swelling stage, and then it contracted back to normal, I guess. And I had no idea that was coming. My seizure struck me totally by surprise.
Wow.
But at that point, they were established. Yeah.
So the swelling, that's the inflammation stage, but it took time to decrease.
Right.
And it's a very, very common with the traumatic brain injury, seizures, and other symptoms that could be appeared later in life.
Exactly, and people don't often know that it's that one incident which caused the stuff years and years later. So that can be pretty scary. Yeah?
So what kind of treatment you had for the inflammation? What did you do?
Well, I was in a brain injury hospital right away. As soon as I came out of my coma after about 3 weeks, and I was there for the next year and a half taking occupational therapy, physical therapy, psychological therapy. I don't even remember what all they did to me. But I was in a hospital that took care of everything, so
Yeah,
who
that's
knows
the
what they did.
biopsychosocial model, actually. Yeah, that's
Yeah.
it's actually the neuro rehab. That's a very good example of the biopsychosocial model, and they started in acute stage immediately, and that's the most effective approach. But the problem, well, you were in the hospital. That's mean you full time there, so you can do the biopsychosocial model there. But when you go out, when you went out of the hospital, you probably did not go through those 5 disciplines. You know.
Exactly. And in my case too, I don't think they dealt with everything because they never warned me that I might get seizures later. No one ever told me, so it was a complete surprise when I started getting these seizures.
Yeah, sometimes it's hard to predict it.
Yeah, exactly. Okay, I wanted to ask you about specifically some of the techniques and instruments you've invented. For example, you talk about scales here, scar scales and fascia scale, trigger point scale, muscle spasm scale. What are they and how do you evaluate?
So in the training I give to the doctors, I teach them how to evaluate the scar tissue, and it's hands-on training. But I'm just gonna give you some examples. You know, when you palpate, there's some sign of scar tissue. You're gonna feel like a knot, or like very hard tissue compared to relaxed muscle. So that's what I start with clinicians to train them how to be intuitive to their hands. And actually the instruments, like the instruments for the scar tissue, is actually sometimes is more accurate than the hand to get the feel of the scar tissue. So I train them how to use the instrument to do actually the evaluation. And the scale I have for the scar tissue is actually they measure it by like inches.
Okay.
And actually when you use the instrument, and actually I have a lot of videos on my YouTube channel. People can watch it. If you go to ASTRinstitute.com, there's a link for YouTube channel, ASTRinstitute.com. And a lot of the videos actually I demonstrated while I'm treating the patient, and I show in the video like the size of the scar tissue. Visually, you can see redness where the scar tissue. So actually, clinician can measure that to have more objective progress for the condition. So, for example, if patient comes with the scar tissue is like inch or inch and a half, after a few treatments, it's probably going to be like quarter inch. So that's a way of clinician will be trained to know how to evaluate the scar tissue. So that's a scar tissue scale, and I have developed another scale to evaluate the fascia. So for the audience, I'll just go over a quick overview what is fascia.
Please.
So fascia is it has several layers. I will talk about the superficial layer first. So the superficial layer, it's like a very thin layer under the skin that's wrapping the entire body. It's like a Spider-Man suit that's wrapping the entire body. That's the superficial layer. There's 4 deep layers, and each layer is wrapping, like one layer wrapping a group of muscle, another layer wrapping each individual muscle, and a third layer that's wrapping each bundle of fibers, and the last layer wrapping each fiber. So think about this way. You are going to a grocery store and you decide to buy produce, okay? So you went and you get tomato and you put it in one bag. So the bags are the fascia, okay?
Okay.
And, so you put the tomato in one bag, and you bought potato and you put the potato on one bag, and you bought like oranges and you put it in another bag, and you decided to put all the vegetables in one bag, the tomato and potato in their own bag, and they put it on a third bag that's putting the fascia that's wrapping a group of muscles. And you decided to put your fruit on the third bag that has the individual bag for oranges or apples or so on. And then you decided to get a large bag to carry everything together. That's actually the fascia system. So you have a wrap that's wrapping the entire body, and you have another wrap that's wrapping each group of muscles, and a third wrap that's wrapping each individual muscle, and you have in each muscle there's a small wraps. So the problem with those wraps is when someone get like a fascia restriction, it's like wearing a t-shirt 2 to 3 sizes too small. So everything underneath it is compressed. And it's overlooked because currently it's in the medical field, it's for clinicians, they don't know how to assess it properly. And the other thing, even if they assess it, how to get to the deeper layer, and that's what what I was able to get through using a special design instrument to release it.
Okay.
So that's basically the fascia system, and a lot of the time, like it's a very common that when someone has a fascia restriction, they say like I feel a kind of pain. That's not actually related to the nerve ending map. And a lot of doctors, when they see that or hear that, they will like, does not really make sense because that's not a nerve pain. Because you're saying it's a wrap around the muscles or around my knee or my forehead. And that's very typical for fascia restrictions. It feels like that. It feels like you're wearing a t-shirt 2 to 3 sizes too small. So I have a scale for the mobility of the fascia, and the clinician actually uses a scale to measure it. It's a centimeter scale. So they measure that, they assess it, and I have values for the normal mobility and the restricted mobility, and based on that, there's maneuvers they can do it using the instrument to actually release the superficial layer, the boob layers, a special instrument to go deep in boob and the muscle. It's a scale for the fascia. And I have another scale for muscle spasm. So it's all about palpation and get the feel of the increased tone of the muscle. So actually the audience can actually feel that if you can just reach with your hand behind your back, like closer to your scapula, shoulder plate, and just push down on your trap muscle. And a lot of the time, with majority of the patient, they're gonna feel like it feels like a band, or it feel like it feel like hard feeling compared to your biceps or in your arm, and that's the skill I train healthcare provider to be able to distinguish between increase the muscle tone, because based on that I have a special maneuvers to actually work on release it.
Okay.
So that's the muscle spasm scale.
Okay.
So I think for clinicians to be able to help patients, they need to know how to evaluate properly. If we evaluate patients properly, we will be able to treat them properly. But if the clinician do not know how to evaluate scar tissue, it's basically they're not aware there's a scar tissue problem. If they don't know how to evaluate fascia restriction, it's like it's not exist, so they overlook it. And that's what I try to help doctors to look at the whole picture and evaluate each problem and figure out is patient has like majority of the pain coming from scar tissue or fascia restriction or muscle spasm, trigger point, or all of the above. So the evaluation will help the clinician to know,
I see.
do I need to spend more time on the scar tissue or spend more time on the fascia restriction or releasing the muscle spasm? And that's actually the job of the clinician to figure it out. So I have a lot of critical thinking process and algorithm that I try to have it in the class to help clinicians to get to that conclusion quickly.
I see. Okay. Okay, very nice. So, do you want to talk about some of the instruments which you patented to help people find these things?
I'm sorry, what's the question again?
Can you talk about some of the instruments you've developed to help clinicians evaluating these stages?
Sure. So the instrument, what I try to do, the audience can go to the website. I have a picture for the instrument, so it will make sense to look at the instruments. So I had to go over 100 prototype and design before I decided on the final design. I had 3 goals in my mind. First is to build an instrument that ergonomically designed. Second, the instrument should not be aggressive to cause pain. Third, the design, the size, the material should promote fast result. And these actually the core value for my treatment. And that's the 3 core value of ASTR. First is non-invasive approach. Second, fast result. Third, long-term relief. So while I was working on those instruments, I went through a lot of prototype because my goal is, and that's what I was thinking, is if I am a patient, I want to get a result from the first treatment. So if my treatment is not doing that, I need to look for alternatives to figure out why we don't get results from the first treatment. And when I start to think this way, I had to go through a lot of prototypes to get to that, to get the fast result that I wanted to be for myself, for my family, and for the healthcare provider to give it to patients. Because a lot of techniques been used, you need to go forever to get to feel relief. And we are in 21st century. It's time for us to advance the soft tissue. And a lot of current techniques been used for hundreds of years. But our lifestyle changed, a lot of habits changed, diet changed. So what I realized, we need to have something advanced for the 21st century to actually meet the need of the problem. So I developed those instruments. So and that's what helped me to get to the design that I'm actually happy with. And thank God that nobody came up with design like this, so I was able to get the patent for it.
Okay, very nice. Okay, so that's some of the stuff for the physical treatment. Can you talk about some of the social aspects of your treatment?
So under the biopsychosocial model, there is great emphasis in the behavior and the social part. And what I realized with a lot of patients, you've been experienced chronic condition. I personally experience it. There's anxiety and depression involved with it.
Mm-hmm.
And the other issue is, when you are in that stage, we get lazy. We're not really we're doing the bad things actually to make things worse, because you get to the stage of giving up, and so with some patient. So I think with the healthcare provider, and what I train doctors to do is to be accountability partner for that patient through asking certain questions about their diet, how they doing, they taking a walk, or the social status. It just to get the therapist involved to guide patient for alternative to help them to get off of that stage. If they cannot, they need to refer the patient out. Like, for example, I had a patient, and he was like, she liked to walk, and she felt bored walking by herself, and she has knee problems. She can walk for a couple of blocks. I'm like, just ask your husband to go for a walk with you. Make it more, motivation, or have someone to, like, friend or family, make a date time, and something to help you motivate yourself. And the healthcare provider can do that when they treat patient, asking this question. And it's easy when we treat patient. Actually, you can tell if the patient is down, or and psychologically is not really in a good stage. And through the training, clinicians should be able to help patient to do that. So I give the patient meditation exercises. Okay, you are stressed, all right. Yeah, I'm not going to give you biceps curl. We need to really work on meditation. So I have them let's do some breathing exercises. Let's get to the room and do this exercises. You need to do that breathing exercise before you go to bed. So those are some of the elements. Excuse me.
Okay.
That clinician can help their patient. Mm-hmm.
Yeah, no, I noticed here in the studio that someone had a question. They signed on to ask a question, then they've signed off again. So I just want to say, if anyone has a question, please sign back on and feel free to ask your question, and I'll put you on the air. But for the moment, we don't have any other questions, so I'll go on and ask Dr. Jacobs here. You say you teach classes. How often do you teach classes?
So every few months I teach a class. I actually started to teach a few months ago, last April. And after I was able to get ASTR teaching material ready for healthcare provider, and the teaching every few months. I have a class next April 14th, 17th, and I'm taking break in the summer, and the following class will be in September and October.
Very nice. So some people are finding out about your treatment in terms of practicing it.
Yeah, currently I have practitioners all over the world, actually. So there's one practitioner came from Australia, another one came from Sweden, from the next from Philippines. So patient actually can start to have, hopefully, in their country, practitioners that practice ASTR. And there's a lot of practitioners here in Southern California. There's a practitioner in New York, Alaska. So my goal is to have more doctors learn how to treat patients using ASTR approach.
Okay, very nice. So you talk about exercise. What about nutrition? how do you specifically, what do you recommend?
So for patients, like if they have a comorbidity, they need to ask their doctors if they can do that or not. So this is just information that I'm presenting. So what I found is, like especially like for seizures, the ketogenic diet has been shown in a lot of studies that help to reduce the seizure symptoms. And so what I will do, and there's other evidence of the effectiveness of the ketogenic diet. So I actually utilize that, and I have some modification to that diet to make sure it's also anti-inflammatory diet, because the ketogenic diet is the original diet is 70 or 80% is fat, but the trick part is you need to have healthy fat, not bad fat. So that's what I go with the patient to tell them, like, and I have actually recipes for them too, to make it easy to transition for that. So what I try to do in the class and the treatment, like I have a lot of interns work with me, so I asked one intern just to, let's figure out how many studies I used for the treatment, and it was over 400 study actually.
Wow.
That for the ASTR approach, from like meditation, from diet, from exercises, from everything. So we utilize over 400 studies. The finding of those studies, that's what I try to implement in a treatment. Because basically ASTR Institute, it's summarized in three things. First thing is research. Second is invent. Third is educate. So during the research stage, if there's a solution, I will take that solution. If there is no solution, my goal is to invent or figure out a solution for it. And then the third goal is to educate healthcare provider to actually implement the solution. So so that's what I use like for the diet. And so patients need to be aware there's a good fat and bad fat, so they need to really be careful about like getting like organic food, like good fat like olive oil, avocado oil, stuff like that.
Okay. The stuff people want to be eating. Right. Okay. So tell me about some of your work on behavior modification.
So when we think about behavior modification, it's there's several aspects of it. And what I usually do is I give a sheet for a patient, and I have them like have a log when they experience pain, when they experience tightness or something like that. And I have them just write down what happened before, what did they eat, and I take that and I start to investigate why. Is it food sensitivity? Is it related to food? Is it related to poor posture in the front of the computer or the TV? Or it's a stress at the end of the day, just, and they start to have a flare up from pain, from clenching their teeth, or, tightening their shoulders. So that's my goal as a healthcare practitioner, and that's what I have healthcare providers take those forms and actually evaluate the patient. And based on the finding of that evaluation, the treatment will be directed to that. So, for example, I had patients that when they start to like work in the front of a computer, they start to clench, and they start to have like tightness in the jaw. They were not aware of that. They were doing that for years. And when I start to have them like have a log, and when did you start to feel pain? I did this. Where do you feel the muscle tightness? So did you clench? I'm like, I don't think so. And next day, oh yeah, I'm clenching. All right. So and I give them tips for how to avoid clenching. So just an example. And it's the same thing with the diet, you know. So like, for example, I had patient like had no problem with peanuts, and when he eat peanut butter, he started to have migraine. And I was like, when we had a law, a log for that, it was like, oh, it's my peanut butter. So probably there is chemical there or some ingredient that caused the migraine in it. So I'm like, okay, I think it's time to stop that. You know, so the behavior modification has to be like, it's a work process. It's not like ASTR treatment is not one size fits all, because our body is so complex that we need to really be open-minded when we treat it. You know, like I had a patient that with migraine this week, and it's a lot of tightness in the frontal area, the forehead, behind the eyes. And while I'm talking to the patient, is she squints her eyes with like every few words. I was like, did you realize you're doing that? Like, no. I'm like, I think it's time to work on that, because I'm constantly release it and get tight again. It's like, for her, it's very similar to example. You're going to the gym and doing bicep curl for 3-4 hours without stop. Nobody can do that, you know. And those behavior need to be modified so the treatment will be effective. So that's what I try to investigate with the patient. Some behaviors are obvious. Other behaviors, it takes a while for even patient to realize it. You know, so the behavioral modification, it could be ergonomic, could be nutrition, could be bad habit, you know, it could be like bad stress management, and that's what I go over with them, you know, how to manage this better. You know, when I drive, I just do this, and I'm like, okay, why would you do that? Can you do some breathing before you do that? You know what I mean? So it's a very customizable. And if healthcare provider, so for example, for that patient that's squinting her eyes, if I work with her, I will work with her forever. If she does not eliminate the trigger, there is no solution. So the idea is to eliminate the trigger. So when patient get soft tissue release, it will be effective because you eliminate the source of the problem. And that's the direction I hope that I will change in healthcare system, is to start to look at the source and treat it, instead of like, oh, you have pain, let's give you ice and heat, and we'll give you pain medication. Pain medication is great, temporary, but you know, we have the avoid crisis now because we're masking the symptoms, we're not treating, and it's time to change. It's time to actually get to the root of the problem. And the only way we do that through training healthcare providers. If the healthcare provider know how to treat patient properly, they're going to treat it. But if the training is on modalities that have been used by hundreds of years, that actually studies show that it provides temporary pain relief, we're not training our healthcare providers to treat patients. We train them to mask the symptoms.
Yes, very true. Okay, when you do your treatment, do you use exercise on most people, or just some, or just a few?
So for the treatment, exercises is essential part. So after I do the release, you know, and audience can go actually watch the videos for the treatment. So based on a study we had on the patient who received ASTR treatment, it was the next study for the entire population that had treatment for 2 years. So it was like a 105 subject. And the statistics shows that 83% of those patients, they experience significant pain relief in the first treatment. And when we had a follow-up with those patients, 1 to 2 years, 87% had the long-term pain relief. And those entire population, that's not a sample study. So if patient, and part of that protocol, I do the soft tissue as an instrument in the first treatment. And when the audience have a chance, they can go watch the videos. Majority of those patients, they can get really increase the range of motion and decrease the pain in the first treatment. A lot of them. Immediately after that, I do neuromuscular education. I don't have videos on it because it's customized per each patient, and the video will be very long if I have the exercise on it. Yeah. But exercise is very essential. So when I work with patients and they were 90 degrees flexion for shoulder flexion, that's midway, and as soon as they get overhead and able to lift their arm up, I start to balance those muscles and work on it to strengthen it so the body will get used to that normal range of motion again. So exercise is very essential. Exercises and ergonomics. I believe to have ergonomic training, even healthcare providers. Excuse me.
Okay.
Sorry, I have a dry mouth. So.
No, get something to drink. Get some water. You've been talking away here.
Yeah.
I wanted to ask you, more talking, of course, but I wanted to ask you specifically about ergonomics. Do you help people so they have better posture and do things in a way that more suits the body while they're at work, for example?
So ergonomic is very essential, especially in our society. So everybody sits in front of the computer, slouching forward, or using their laptop or their phone, and their head is down all the time. So the problem with bad ergonomics is long-term of bad habits. It's, for example, if you slouch forward and for a long time in the front of the computer, you're going to start that healing cycle again. You're going to have a micro tear on those muscles. And when you start to have micro tear, inflammation, proliferation, and you start to build a scar tissue. And a lot of people do not realize it that, I have neck pain, but I did not have injury. Why I had it? Because you've been slouching for 20 years. It's time that you had a lot of scar tissue. You built it over the years. Instead of you had one layer of scar tissue, you had 40 layers. And when I palpate it, it's a big tennis ball knot, So a lot of this happened from bad ergonomics if we don't know the accident or the trauma that occur. So ergonomics, it's very essential for everybody, especially with our society. It's hard to find someone with good ergonomics. Even healthcare providers. I like to be honest with you, in the class I teach, it just every half an hour I have them sit up, stand up, everybody starts to slouch again. I'm like, okay, we need to practice what we preach. So let's practice proper ergonomic and good posture.
Yes, that's very true. I find myself, when I'm sitting in front of the computer here trying to get something done, my husband will often walk up behind me and just physically straighten me up with his hands.
I think the best way, every 20 minutes, we need to get up and just move around.
That's a great idea.
Plus, following the proper ergonomics for sitting, having the right chair, putting the monitor in the right level. It has to be ergonomically designed work environment.
That's very, very true. And I know the proper chair is crucially important. Most people don't even realize that. Lately,
because of the chair. if the chair poorly designed, the chair could make you like really slouch badly, and put more stress
Right.
on certain joint than others, and yeah.
I know a lot of patients recently have been asking us, what kind of chair should they get? They're thinking of getting a new chair, and they're asking us, what kind of chair should I get? Should I get a ball or a chair or whatever? And it's like, well, that really depends on you and what you're using and how long you're doing it for and where you're doing it. Millions of questions.
Yeah. Yeah, the best thing is the one that it's hard to find a good ergonomic chair, and I was looking for that. So sometimes if the chair wide, a lot of those chairs they just design it for giants. A lot of those chairs, if you cannot move the back forward and backward, just get a pillow behind you, so you don't slouch.
Yes.
Yeah.
Well, my husband always tells our patients, get several different chairs and move from one to the other. Don't sit in any one chair for a long, long time.
That's actually a good idea, because if you are in one chair, you're just gonna get lazy, slouch forward. But when you change, just moving, like the idea of like every 20 minutes you stand up, you stretch a little bit, you move around, you move your arms, your neck, and get back to work. That's actually, you're gonna get back to normal posture, hopefully. And then if you sit for 2 hours, you're gonna slouch, you're gonna bend forward, you're gonna go toward the gravity, which is gonna pull you down.
Gravity has a way of doing that, yes.
Yeah.
Isn't that the truth?
Mm-hmm.
Okay. So I wanted to ask you again, tell people what your YouTube site is so they can look it up.
You asking about the YouTube site, the website?
Yes.
It's very simple, actually. It's just go to asterinstitute.com, astrinstitute.com, and in the website I have actually the videos on the screen, so they can watch everything on that website, and they can actually go on the top of the top bar. It has find a provider. If they are interested to get ASTR treatment, they can click on find a provider and look for a provider that's closer to where they located. And in that actually website, and I purposely have like educational videos on the website that I explain ASTR and the biopsychosocial model, and I explain the scar tissue in detail and provide a lot of studies. So the goal of that website is to educate patients, educate health providers, and actually I have, a lot of like useful information for patient can utilize, hopefully to manage the symptoms.
Okay, Joseph, why don't you go get something to drink, because I can see your throat's getting scratchy.
I have it now. Yeah,
You have it?
I have a water with me.
Okay, I was going to say we can take a little break and you can go get something to drink. I'll play some music,
Yeah.
but okay, you have some water beside you then. We can talk some about trigger points. Once someone gets trigger points, are they likely to recur at the same spot?
So it's let's go to the history of the trigger point, because that's a debatable subject in health care. Because when a lot of therapists, when they palpate, if they trained on trigger point release, or they think it's trigger point, they think all the knots are trigger points. And other healthcare providers that they think scar tissue could be an issue, they will believe that's a scar tissue. It's the nod that you feel it. But when I start to look at a lot of anatomy and physiology books about the healing cycle and how the body heals. The reality is it's a combination of both.
Mm-hmm.
And healthcare providers need to know how to distinguish between them because the treatment totally different.
Yeah. Yeah.
You cannot treat trigger point as a scar tissue and vice versa. And I spend a lot of time in the class to differentiate between them to help healthcare providers to actually know the difference. Trigger point, a scar, when you have a scar tissue with a lot of cases, but some cases doesn't. So the evaluation has to be accurate to actually distinguish between them. Both of them are nodes. Trigger point, by definition, it's referred. There's some trigger point that's referred, cause referred pain on, up or down of the trigger point. But it's a trigger point by definition. It's a contractile tissue. So it's a kind of contracted tissue. Scar tissue is a fibrosis. It's a scar. So that's the technical difference between them. And the evaluation is it has to be comprehensive to figure out which one of them. Because when you palpate, it's gonna feel both of them like a knot.
Mhm.
Does that make sense?
Yes. Yes. Okay. Okay. So you teach doctors how to distinguish between the two of them. So they can treat them both differently.
Yeah, because it's a different issue. And so for the scar tissue, I have those instruments to release it. For the trigger point, there's maneuvers to release the trigger point. So they need to know, are they going to use maneuver or are they going to use the scar tissue instrument? To make the thing more complicated, there's always fascia restrictions. So is this not because you remember the fascia, the sac that's wrapping the muscle? That would be causing it. That sac is actually causing compression on the fiber that misperceived as a trigger point. So healthcare provider, they need to figure out, is it the fibrosis? Is it the trigger point? Is it the fascia that's actually causing this to be like kind of contractile tissue? Because you actually can get, you practitioner, you know that. So when you palpate patient, sometimes you feel like there's a band, band fiber. You feel like there is a string or like a rope. So that's healthcare provider, they need to know that, and that's like, it feels like contractile tissue, but it's not trigger point. It could be from the fascia restrictions, or could be scar tissue that actually cause the trigger point because the muscle is start to, think about this way, the muscle is like a rubber band.
Okay.
So when the muscle contracts and relaxes, the rubber band has to be stretching. So if you have a knot or scar tissue in the rubber band, you have a knot in the rubber band. So when the rubber band stretch, it does not fully stretch. You start to have the muscle spasm. And when that happens, you start to have false or faulty constant contraction in single fibers. That's when you start to have trigger point. That's a contractile part of it.
Okay.
Does that make sense?
Yeah.
So the treatment has to figure out, like, is it the chicken or the egg? Which one came first? So we need to figure out, like, why there's band there. And with palpation, when practitioner and even like patient who listen to us now, you can palpate, you can feel like, if there's a issue, you probably will notice either it's a band or it's a knot, it's a circle, it feels like marbles or grain. So all this feeling has meaning. And each one has different protocol of treatment because each one has it presents a different problem. And that's what I actually spend a lot of time with the healthcare provider. You need to distinguish between them. Because when you feel it before and you know the right treatment and you release it, you feel it after, you will notice the tissue start to be more pliable.
Okay. So I want to ask you another question about scar tissue. Does it always come up does it always come up after every single injury we have? And is there a way that we can deal with that?
It's always happened with any injury. It's part of healing. Just visualize this. When you have external cut, if your body does not have a scar tissue, it's open wound. We have to have a scar tissue for survival. It's the same thing happens internally. When someone has accident, you have a micro tear inside, and if the body does not build a scar tissue, it's not going to heal. For a good example, if you have a tear in the on an artery or vein, and the body does not build a scar tissue, it's an internal bleeding, death. So scar tissue is essential for our survival. The problem is when you have too much of scar tissue. That's in the way of other tissue, restriction range of motion, compress on nerve and artery. So it's very common. Like I have a lot of patients that have sciatica from scar tissue. It's not the back. It's not herniated disc. It's not like pinched nerve. It's a big fibrosis, which is the technical term for scar tissue in the glute area or the performance area that's compressing on the sciatic nerve. So healthcare practitioners can spend their whole life working on the back. They are working on the wrong spot. Yeah, so some sciatica comes from the back, but healthcare practitioners need to evaluate the entire system to see is it the back, truly back, or it's coming from the performance muscle? Fibrosis or fascial restriction around it. Yeah, the answer is scar tissue is occur with any injury. The problem is there is too much of scar tissue.
And some people develop it more easily than other people too.
That's correct. So there's a lot of factors for that. One of them is genetics. Some people really build the scar tissue very fast, excessively, and the other is just they have a lot of injuries that they build scar tissue. But the problem as we get older, actually our body ability to break the scar tissue decreases significantly. That's why you will see with older people, they have a lot of issues because they build a scar tissue throughout the years, and their body's just not unable to handle it because it restricts range of motion and cause pain.
Okay. So what happens, what do you do if a person doesn't move fluidly through the range of motion? They get stuck in some areas.
So what I do is evaluate and figure out why this patient does not have a full range of motion. So I try to, first I will rule out any red flag. If there is red flag that causing the restrictions, then what I use is a process of elimination. Just palpate and feel with my hand. Is it scar tissue? Is it fascial restrictions, trigger points, muscle spasm, or could be other issues like length discrepancy or muscular imbalance? I have to go through that list And over time, and especially the clinician actually that take the class, they will be very quick on their feet of figuring it out. Because they see the same thing over and over, you know what I mean? So instead of like going over like the entire list, you will like, my gut is telling me, and when I'm evaluating, I feel more scar tissue. My hand is just, I feel it, you know? I feel the fascia restrictions. And over time, like tennis elbow, because I saw a lot of those patients, just get to the instrument that I know I can get the 4 range of motion with it. Because I know this is the instrument that will give me the fast result. From a lot of experiment, I experiment. And I have protocols for healthcare providers, like for each diagnosis, where to start with, so you don't spend too much time to get the 4 range of motion.
Okay. Okay. So that's good. So how long do patients spend at each session with you or another ASTR doc?
So because I'm implementing the biopsychosocial model, it's a comprehensive treatment. Like we touch base on, well, during TEDx talk, I was talking about 10 elements I was addressing with ASTR treatment. So a year later, it's 11 elements, and maybe next year there'll be 12 elements. It will really be comprehensive treatment. So, so the patient spent 45 minutes to an hour, but we addressed 11 elements of the problem. We addressed the biopsychosocial model. So that is saving time of going to 5-4 practitioner.
Right. Okay. Okay, that sounds good. So just think about it as saving yourself time rather than going to 10 different people. To go to one person and do 10 different things or 11 different things.
That's right.
Okay, that makes some sense. Okay, so do you personally advocate meditation?
Yes. I have to do it every night before I go to sleep.
I see.
Well,
so
think about our lifestyle. There's a lot of stress we're going through. You know, we're not living in a country like under a tree. You know.
Yeah.
It's just you have traffic every day. You have like deadlines you have to meet. You have some bills and stuff like that. So stress is part of the industrial life. You know, and based on the studies, there's more. We are going through really a lot of stress compared to like 50 years ago, when you did not have a lot of technology, a lot of things that, you know, causes stress. So, and you add to a stressful lifestyle, you add to that chronic condition or injury, you make it worse. The stress level will get worse. You know, from personal experience, you have migraine, you're going to be under a lot of stress. I had that. You know, chronic pain, yes, you will be under a lot of stress. Why? Because you're not able to work, or, you know, you're not able to go for a walk or run. I'm stressed because I'm gaining weight. You know, it's a vicious cycle. Yes, the answer, we need to work on that with all patients.
Yeah.
That's why, you know, when we think about each of those 11 elements, it's hard to ignore them when we actually investigate the benefit and the need for it.
Yeah. Okay. Okay, very nice. So, yeah, I'm trying to think of any other questions that people might come up with later on while listening to this. because, well, to me, obviously, well, for example, one of the things you say you work on in your website is headaches, and that's one complicated issue in itself.
Mhm.
Headaches. I mean, so do you have a special scale or tool to evaluate headaches?
Yes. So for headache, the most common headache is tension headaches. It's like around 95% of the headache.
Uh-huh.
And I have a lot of videos on headaches. If it's tension headaches, it's patient respond very, very well with ASTR treatment. Majority of them, they can experience pain relief in the first treatment for the headache, if it's a tension headache. If it's a migraine headache, it's a very involved, and it's individualized. So we have to work with nutrition, we have to work on meditation, ergonomics. If it's not coming from the brain, I usually think about soft tissue, and I work on that. And most of those patients, they usually, before I see them, they usually have CAT scan and MRI, and if everything is negative, so I will assume it's it's scar tissue, fascia restriction in the occipital area by the skull that compressing on the vertebral artery. So it decreases the blood flow to the brain, and that could cause headaches. And I had patients had that. And migraine, you can have it from skipping meals or dehydration. Some patients, that could be the trigger. So with this patient, I work with them to, I have a list for common triggers for different conditions, for the headache, for migraines, stuff like that, and I give that list to the patient. Plus, we do the lifestyle analysis to figure out if there's something else not in that list that they are they have as a trigger for the headache. So it has to be individualized treatment. But for tension headache, yes, with the instrument I have, and the maneuver, it's just a phenomenal result. And I do after that we do ergonomics, neuromuscular reeducation.
Okay, that's good to know, because I think most people, especially head injured people, suffer from headaches. Headaches and sleeplessness.
That's common, yeah.
Yeah.
Yep. And usually tension headache, and reality tension headache, what is it? Where does it come from? It's a very typical fascia restriction scar tissue. So we need to figure out where is the location of the fascia, the restricted fascia or the scar tissue. And if a healthcare provider know how to evaluate that and find that location and release it, that will relieve the tension headache. It's a musculoskeletal issue.
Right. Okay. Very nice. So, back to what we started talking about at the very beginning of the show. Your wife's problem with her jaw pain, her TMJ disorder. Was that resolved?
It's a result of a stress. So the TMJ, yeah. And I talked to a lot of oral surgeons, and what I have found is it's a lot of, majority of those patients, they have it from stress. Around like probably 30%, they have a structure issue that could cause the TMJ or TMD. But majority of the patient is stress, and how this develop is from clenching or grinding their teeth.
Yeah.
So when you think about someone, like for example, my wife, she was going through under a lot of stress. She was teaching high school kids. in a low socioeconomic area, so it was very stressful for her, you know. So she was clenching a lot at night. And think about this way: you are in the gym doing biceps curl for 8 hours. Of course you're gonna have headache from that. Of course you're gonna have pain. Nobody can do biceps curl for. And when someone clenches at night, it's a constant contraction of the muscle. So you start that healing cycle again. You start with inflammation, and then you start to have micro tear in the muscle because you just wear it. Then the body starts to build the scar tissue in that area.
Yeah.
And fascia restriction. It's a vicious cycle. So when healthcare provider think about from the healing cycle perspective, it just makes a lot of sense. Because think about the healing cycle is the codes of the program we have in our computers. You know, you need to know how the codes runs in the right sequence, and you need to know how to read it in order to treat it. But the current system, when you have an error message in your computer, do you know what the current treatment? I don't want to see the error message, so remove it from my screen. That's the symptoms. But the error still exists. That doesn't mean, if you don't see it, that doesn't mean it doesn't exist. It's just in the background. You mask it with temporary treatments.
Correct. Yeah. No, I'll just mention one thing here. One of my patients, for example, had a TMJ problem. His problem comes from a lot of dental work as a kid. I mean, his teeth just didn't fit in his mouth, and he had to wear braces with a full thing around his head for 3 or 4 years. And now, 15, 20 years later, his mouth is just destroyed. He gets major headaches every couple weeks from that.
Yeah, that's sad. Yeah, because especially if the dental work is not, it causes malalignment and cause like uneven bite that could cause TMJ or headaches, because it's basically your joint out of alignment, just things will not going to work properly, sliding, and causing contraction for the muscle that should not contract,
Yeah, exactly. Muscles weren't meant to in the first place, you know?
Yeah.
Yeah, so, I mean, there's all sorts of reasons for all these problems we all have, but, we all have our own individual problems, and we have to find ways to deal with them.
That's right.
As individuals, we need a doctor or somebody who can look at us as individuals.
Yeah, the treatment needs to be customized, not like a cookie cutter treatment. Yeah, and you can see that actually it's really sad because, I had the same training, and the problem is just everybody's doing the same thing. Oh, stretch your strength and just do joint mobilization. That's great, but let's get to the root of the problem. Let's see why there's tightness, why the joint out of alignment, and get to the reason instead of just quickly fix it now. I don't want to see it out. I don't want to see the tightness. Let's stretch the muscle. Actually, studies show this is not really effective. The stretches actually can cause more harm. Because think about this way. You have a rubber band and you decide to overstretch it. What's going to happen? It's snap.
It's going to go slim.
Yeah, so you actually could tear your muscle from overstretching. And you're not going to break the scar tissue. You're not going to lose the fascia tightness, because it's not going to respond to that stretch.
Mhm. Do you find that often in your work?
Find what?
People who have been treated too much, for example, and the muscles aren't working.
Yeah, what I have found, because I see a lot of chronic conditions, so majority of the patient I see is they actually tried everything under the earth because they, they just had treatment for symptoms, and unfortunately, some treatments that actually cause more issues than benefit. So I'm not going to mention the name of the treatment, but I have a study on it. That very well-known technique that advertised everywhere, that's therapists crazy about it. They had a systematic review on it, and if the listener want to know this, I will just give them the study. That the systematic review compared the treatment to active patients, just have active lifestyle. What they found is the active patient, which is the control group, they actually did better than the treatment itself. So the conclusion, do not do that treatment. and it's really sad. And actually, in the website for that technique, they actually have a lot of studies, but those studies compare how does the muscle respond to it, but they did not include the study that shows the function improvement for patients. And that's make me feel like, we need to think more about patient and be ethical when we treat patients, not about just making money just for teaching something that's effective. Does that make sense? We need to start to treat patients as ourselves. That's true. That's how we can change our health system. And instead of treating like number or, just making money.
Yes, you're right about that.
Yeah.
Right about that. Okay. Well, is there anything you would like to say since we're nearing the close, we have half an hour left, but is there anything you would like to say to wrap things up or to conclude your message?
Yeah. So I think from patient perspective, because I used to experience chronic migraines and headaches and pain, I think it's the patient responsibility is to find a practitioner. They need to question the treatment, and they need to be proactive about looking for healthcare providers that try to get to the source of the problem. It's our duty to actually be responsible and take a charge of our health instead of being passive of, the treatment is not working, I will just continue with it. I'm like, we need to start to be proactive as a patient. And hopefully for healthcare providers, the only way and I believe that every day, the only way I improve the way I treat patients or get better result is through research, study, and try to learn something that I'm not aware of. Every day I learn something new that helps me to improve my treatment. And I think if healthcare providers do that, they're going to see amazing results with their patient because they will learn the techniques that will help them to improve their practice or improve their patient quality and, help them. So it's a proactive action from both ends, healthcare providers and patient. And there's a lot of holistic practitioners everywhere. Patients have the choice to go to someone really care and try to help them instead of just, get lost in the system.
Yeah. Yep, that's easy to do.
Yeah.
Yep. So, would you say that a lot of people would you say that most people with headaches, for example, can get them cured, get rid of them completely?
I personally had chronic tension headache and chronic migraines.
Ooh. Not good.
And that's before inventing ASTR and implementing ASTR treatment on myself. And that's one of the reasons that I have a special protocol for headache and migraines, because I was so frustrated of what currently available for headaches and migraines, because I did not help myself with stretches or the manual stuff or the ice and heat or stem, or I did not find relief for myself and for my patient. So I had to search for solution. But part of it is patient compliance is huge. Because if patient just not eliminate the trigger, the treatment is useless.
That's true.
If the trigger like certain type of food and they keep eating every day, I'm like, I cannot do anything to that.
Yeah.
They might feel better for a day or two after the treatment, but they slouch in the front of the computer again and start to clench their teeth. So the treatment has to be comprehensive, but also the patient has to be proactive of, compliant, and just it's a teamwork. It's not individual work.
Right. You're absolutely correct. People don't realize how important that is. It's like, hello there, you've been searching for doctors to treat your particular problem for a couple of years now. Keep searching till you find it, because they're out there somewhere. Yeah.
I will tell you something funny, actually, and it's not funny, it's sad. So I had a patient, doctor referred, like she found me online, and the patient had like a frozen shoulder. Mm-hmm. And so she had it like in the mid-range, like restriction. And she went to her medical doctor and showed him her shoulder and asked him, like, what should I do to that? It's like, unfortunately, he told her, you have more range of motion than me. And he showed her his shoulder. I'm like, okay, how are you going to give her treatment if you're not, treating yourself? You know what I mean? It's just sad.
I know. I've seen that so often, yes.
Like a doctor says, oh, don't smoke, because that's going to, you're going to get cancer from that and cardiovascular diseases. And you smell the doctor is just, he had like a whole pack before the practice of smoking.
Yeah. Oh, yeah. And it all ties into everything. I mean, it's all, like, you work in different areas because they're all important.
Yeah.
Every one of them.
Yep.
Yeah. So, do you recommend, for example, when you first get an injury, to take Tylenol or ibuprofen or aspirin to help the inflammation and the pain? Do you recommend something like that?
Well, I'm a physical therapist, so it's drugs is not our scope of practice, which is actually good in its way, because if I'm gonna prescribe something, I have to prescribe something natural. you know?
Yeah, that's the way we chiropractors are. Yeah.
Yeah. So
Yeah.
you prescribe something natural, so you need to figure out a natural way. But here's the thing. It's not one size fits all. If we say like acute injury, you take this medication or you do this kind of treatment, did you evaluate it? You need to evaluate it to know what type of treatment is the best treatment. And I get emails and phone calls, people from all over the world, and say, can you help me? I have this elbow pain. I'm like, I have no clue what's going on with you. I have to put my hands on it and actually feel it.
Yeah.
I cannot, you know what I mean? So if we don't do the proper evaluation, we're probably going to do the wrong treatment because you're treating blindly. Does that make sense?
Absolutely.
So, and that's not getting to the roots of the problem. That's hope for the best, you know, just.
Yeah, it's true because we are all each unique individuals and things are going to be different.
So, like for example, I had a patient had a migraine, and his migraine was, he had scar tissue and fascial restriction compressing on the vertebral artery behind his head that decreased the blood flow, but also another trigger. So he had that decrease of blood flow and the oxygen level from his neck, plus skipping meals that decrease his energy level and the oxygen level too, because he's not having enough energy. So the migraine is from two triggers. So when I did the evaluation, I found he did not eat, and he constantly skipping meals, and he did not have breakfast. The day I saw him, around 1 o'clock, he did not have water, and he has a lot of those restrictions. So during the treatment, I just give him my food, and then I give, and I worked on the scar tissue and released his neck, so he left without migraine. But I will not know that unless I do, proper evaluation to figure out why we have this issue.
Yes, that's true. That's very true. Okay, so do you have any more patients to present interesting cases you want to talk about?
So I want to talk about a concept that's really overlooked for healthcare providers and for patients. And I usually have this conversation on a daily basis with patients, and I presented that case in TEDx talk that I had a patient with very limited shoulder range of motion. And the patient had traumatic brain injury 4 years before that second accident he had on his shoulder. And when I looked at this patient, I found that he has really huge scar in the forehead area. I cannot miss it actually. So the patient came with a limited range of motion for the shoulder, halfway, and did not have a lot of pain. So evaluating the patient, I actually decided to work on his forehead. And as soon as I worked on that, and I asked him, let's try to see how your range of motion. He had full range of motion and pain-free.
Really?
So, and that's an interesting case because everybody was like, that doesn't make sense. But when you think about our body as one piece, think about our body as one chain. So when you have a tension in one end of that chain, you have three options for pain. One is the location of the tension. Two, your weakest link in the chain. Three, both locations. We cannot separate the head from the shoulder and vice versa. And when you think about the fascia system like a Spider-Man suit that's wrapping the entire body, if you have tightness in the back, it's gonna restrict the front from moving. You know, very good example for the audience. Go behind your back and pull your shirt backward. Where are you gonna feel the tension? You're gonna feel it in the stomach. It's not in the back. So when you do evaluation for the patient, and especially when I do training for the fascia restrictions, we don't treat body parts. We treat system because it's a system. The fascia system does not have beginning or end. So why I treat it as muscle has beginning and end? Oh, it's a shoulder. So let me see the biceps and triceps. Another good example, actually, and I have this patient actually video online. Her video, it was actually video testimonial. It was like follow up, like I think 5 or 6 months or 4 months after the treatment. So this patient had a chronic back pain. She used to have PRP injection every year because of her pain. And she tried everything. So when she came and she told me about her pain, and I was like, I asked her, did you have any surgery? And she said, yes, I had C-section. So I'm like, okay, do you feel comfortable? And I have a female assistant work with the female patient in those areas. So it was like, I think I worked like on the upper part of the stomach, yeah. So I asked her, can we work on that? She said yes. So I worked on it, one treatment. She came like one treatment actually. She came 4 or 5 months later and she told me, do you remember that one treatment you did it on my back? And I was like, no, I don't. We did one treatment. She said, that one treatment, I was scheduling the PRP the next week and I canceled it.
All right.
So that's, that was like a different body part for the problem.
Good stuff. Good stuff. Yeah. That's the kind of stories more people should take seriously because there is an answer. You know? We just have to believe in ourselves and believe we can find it. Okay. Well, the show's just about over, so I will say goodbye to you then. And
thank you.
Yeah, tell people how they can reach you, Joseph.
Yeah, so the easiest way, they can go to the website, ASTR Institute, ASTRinstitute.com, or if they have any question, they can call us at 888-210-2787. Again, 888-210-ASTR.
Okay.
That's the phone number.
Very nice. Thank you very much for being on the show tonight, Joseph. I really appreciated it.
Yeah, thank you so much. I really appreciate it. It's been an honor to be on your show.
Thank you. Okay, then. We will say goodbye to Joseph, and we will wrap up the show. But before we wrap up the show, I'll play some music here. Let me find some good music. Some good music is right here. And we will listen to we will listen to one of our couple head injury survivor musicians, and Kevin MacLeod, Groundwork. Okay, very nice. Now I just want to say a few words for the last 5 minutes or so. This was a very interesting show tonight, and that I am a chiropractor, so we are trained to work on the whole person. And chiropractors have kind of there's a little block between the communication between chiropractors and physical therapists, because we both do a lot of similar things. And it was really nice to come across a physical therapist, a doctor of physical therapy, who believes the same way I was taught to believe in school. And that's really encouraging, because there are people out there from different disciplines who are trying to help other people get on the right path. And as Dr. Jenkins was saying, it's difficult because the path might be different for every single person. So we can't just learn one formula and expect to go out and treat everybody, because it's not going to work. It's like taking medicine. Some people it works great for. Some people it works kind of mediocrely for. And some people it doesn't work at all. And you don't know what kind of person that is at the very beginning. You find out working with that person, what kind of treatments do best with that particular person. And it's nice to know that there are doctors of various disciplines working on this throughout the world. That's what Dr. Jenkins was saying. He's trying to get practitioners in every different country who can deal with the people in their area or every different city. And it's so nice to hear that there are other doctors out there, there are other people who are concerned about the particular patient. Who cares about how much money you make or where you're going on vacation? Because the important thing is finding a way to help other people who need help. Sure, we have to help ourselves in the process, but other people can help us in the same way that we help other people, because what goes around comes around. There's always somebody out there who could help you. I was telling somebody today, one of my patients, how I read in my prayer book at the synagogue about guardian angels and how everyone needs a guardian angel at some point in their life. But more than that, everyone acts as a guardian angel at some point. Because someone out there will need exactly what we have to tell them. And we're the only ones who can tell them that. So we don't necessarily know when or how it's going to happen, but everyone in the world is a guardian angel to someone at some time. And that, to me, was really encouraging and really a nice thing to read about, because I love the fact all guardian angels, we all do good to somebody at some time. Maybe we're not good all the time. Maybe we're not helping people all the time, but someone needs us. Someone needs what we have to say to them at some point. And we all have that to give. And we never know when we're going to be called upon to do that. But the fact that we are each called upon to do that at some particular time is a very, very nice thing. And it's a wonderful thought to read about. And since the show is just about over, I'm going to play some music that we can leave the show on. Okay? It's going to be Nicholas Datan, also a supporter of the Head Injury Group, Brain Injury Radio, Piano Master. That's Nicholas Datan. Okay, good night, everybody. got to be. Good God, Bob. Yeah, it was raining pretty heavy, but it's fine now. Good Lord. You're still peeing? Usually in short time I figured a little pee, but good Lord, Bob.